Good afternoon, everyone. Thank you so much for joining us for this important town hall meeting about the state of Michigan's Poverty Task Force and our policy recommendations that we have presented to Governor Whitmer for 2021. We are so heartened by the response that we've gotten from so many people across the state of Michigan about the work that we have done over the last several months to talk about how we can leverage the work of 14 different state departments to better serve Michiganders who are struggling, with the ultimate goal of helping to lift Michiganders out of poverty. Today, we're going to talk about the governor's belief that there's no single way or no single face to the problem of poverty. There is not one single cause. There are many approaches, and unfortunately, there are many consequences. And so we have this multi-dimensional approach that we really worked hard to not be siloed in our thinking for how we try to develop this anti-poverty agenda. The governor issued a executive order in December of 2019. I came on board in 2020, January of 2020, and we all know that just a couple of months later, we were plunged into the greatest public health crisis of the last century. And one thing that we have learned from COVID is that our safety net in Michigan was woefully inadequate. And so we believe that the time was right to really have a deep conversation about how to address poverty. And so if we're going to talk to you a little bit about the agenda that we presented to the governor and how we are hoping that you can help us move this agenda across the finish line. We'd love to have your feedback. And more importantly, as we build for 2022, we're going to continue to refine our ideas, but most importantly, try to get a lot of, if not all of this agenda done in the next 12 months. So with that, Michael, if you can just switch the slide for me. So our goals for this agenda are to reduce the ALICE population. And we do use ALICE as the frame for this. ALICE is a statistic that has been created by United Ways. It stands for Asset Limited, Income Constrained, and Employed. In other words, working people here in our state, sometimes people who have not just one job, but multiple jobs, who even through their best efforts are still not able to make ends meet. And unfortunately, about 43% of our population finds itself not being able to pay their bills comfortably. And so again, we try to build a collaborative and interdepartmental approach to this. I think a lot of times when people think about poverty in the state, they think about it from the perspective of the Department of Health and Human Services, or maybe LEO, but every state department has some role in trying to help us address poverty, and that was how we approached this work. And because of the governor's commitment to racial equity, we have really made that a cornerstone of our work. We started our work with a presentation from the Michigan Department of Civil Rights to talk about some of the policies that are in place that have created economic disparities, and how in our work to try to undo those disparities, we have to always have that racial equity lens. So for several months, we worked in work groups to talk about how we can broaden programs that are already in place, create pilots to try to branch out and be innovative, and maybe even introduce legislation. We want this program to be bipartisan. We want it to be supported. We know that there are ways that we can have consensus on some of these issues. So some of this will be legislative, some of it will be what the governor can do administratively, and some we're hoping to do pilots so that we can kind of be innovative. And so the 4 work groups that we created is the first one is Safe and Secure, which is a work group that really talked about, or a structure within our work that focused on ensuring that people had their basic needs met. met. So, ensuring that people were able to live in quality housing, ensuring that they had utilities, basic needs, and certainly food security is part of that. Strong Beginnings is a work group or is a bucket that focused on trying to combat childhood poverty. We know that far too many Michigan children are living in poverty. And we also know that we have to have a multi-generational approach, but we cannot ignore the impact that it has on children. Finally, removing barriers is our third bucket, where we talked about those things in state government that made it difficult for people who are struggling to succeed, to have economic mobility. One of the groups that we really concentrated on with that is returning citizens. What are the laws and programs that we had in place, the statutes that we had in place that really were preventing returning citizens and others from succeeding? And then finally, providing opportunities, which is that's the long game. Those are the strategies that we were trying to build to ensure that people really can have economic mobility. We know, most people know that as a state, when we're talking about our economic policy, we know how important talent attraction is. We have talent here, we just have to cultivate it. And so we think it's really important for us to help those Michiganders who want to get that post-secondary credential, who want to get that secondary credential. We have far too many Michiganders who don't even have a high school diploma. So helping them move to getting the training that they need to get more lucrative jobs. We know that when you have more talented people, the jobs will follow. We are really trying to help people get those certifications and credentials that they need so that they have that long-lasting economic stability. Next slide, please. And so we had 35 policy recommendations that we introduced to the governor, and they were organized around 5 areas. Benefits, again, when we talk about the social safety net and how our state is serving people who rely on it, are we doing it in the most efficient manner, and are we really serving that population? Economics, do we have strategies to help people who are low income really kind of transcend generational poverty? Education, again, we recognize that education is by far the most effective anti-poverty strategy. How do we leverage it so that we help people be prepared for 21st century jobs? Criminal justice, how is our criminal justice system preventing people and their families? So there are people who are in the system who maybe should not be in the system. There are people who there are different paths that we can take to help them overcome, particularly when we're talking about youth, youth who are opportunity youth. What do we do to ensure that our criminal justice system is not locking people into a cycle of poverty? And then finally, health, safety, and housing. That covers a lot of different priorities that we have that you'll hear about. But we know from the COVID-19 crisis how if you don't have health, you have almost nothing else. We really were coming together to try to ensure those basic needs were met in our poverty agenda. Next slide, please. So just to give you a few ideas about how our benefits group came together, I started off by saying that our safety net is inadequate. If you have been following at all Michigan's quote unquote welfare reform strategies over the last 20 years, you know that we have in some ways one of the most punitive systems in the state, in the region, particularly in the Midwest, but really in the entire country. The average state spends about 52% of their TANF, and TANF stands for Temporary Aid for Needy Families, temporary assistance for needy families. About the average state is spending about 52% of that block grant that's going directly to people who are struggling. In Michigan, the percentage is 19%. We are an outlier. We are spending money that's intended to help our struggling families succeed on things that have nothing to do with poverty eradication. And so we want to ensure that we're able to better leverage those dollars so that they're serving their intended purpose. And one way that we would do that is by allowing people to use part of their TANF dollars for shelter. We know that the amount of money, the amount of vouchers that are out there for housing are limited. We know that housing costs are going up, while the TANF dollars that we are able to get, or that we have chosen to give to our struggling citizens, has really kind of fallen behind. We want to make sure that people are able to have access to those dollars. Next slide, please. Children's savings accounts is something that we're very excited about, and a lot of states have really leveraged this as a tool to help families who are struggling to really get a tool to help their children when they are ready to go to college, when they have extracurricular activities they want to pay for. We know that some of our school districts have had to severely cut or charge people for those services. We want to make sure that people have access to dollars. And so what we're doing is working with philanthropy to put together a network, a statewide network. There are a lot of communities that already have children's savings accounts, collaboratives. They're working with cities, they're working with counties, they're working with school districts. We want to incubate those kind of programs so that more low-income students particularly have access to savings accounts that will help their family with economic stability. And then when we talk about removing barriers, we know that particularly because of the COVID crisis, we have had a spike in parolees. When they leave prison, we don't want them to recidivate. We want them to be successful. And one way that we want to ensure that they are successful is by making sure that they have safe, affordable housing. We do have a voucher pilot program, and because of CARES Act dollars, we were able to expand it, but it's still not enough to meet the need. We see this as a successful program. It's something that we want to expand. And again, these are just a few examples of some of the proposals that we have. We've been actually lucky in that, I shouldn't say lucky, that's not the right word. We have been successful in being able to have criminal justice reform through the efforts of the Lieutenant Governor and the Chief Justice of the Supreme Court and others who have really tried to shine a light on how and I should also give credit to the legislature, because there has been legislation that was passed during the lame duck that will help us reduce arrest for failure to appear. We know that that was the #1 reason people were being arrested. It really is counterproductive if someone goes to jail, particularly when you're talking about a lot of times it's just a spiral. Someone may get pulled over because they don't have insurance or because they don't have adequate licensing. They get a ticket for that. They don't show up in court for that. They get a warrant out for their arrest. They end up going to jail. Then they're never going to be able to pay whatever tickets that started this whole cycle in the first place. And so really taking a hard look at how we can reduce those arrests so that we can, again, help people not get into a financial hole that they're not able to get out. And the same thing goes for having higher thresholds for pre-trial release conditions. If people are in jail, they can't go to work. If they can't go to work, their families are suffering, and it really kind of deepens the hole that they're in, not just financially, but with their attempt to not be incarcerated. I mean, when you're sitting in prison or sitting in jail in times when you don't really necessarily have to, and you can be a productive citizen while you're awaiting your trial, it could be better for the community than having people just locked up. And luckily, we did have legislation on both of those items that was passed. So I put that in the accomplishment pile, but we still have work to do. Apprenticeship opportunities, we've been very, very successful in the state of Michigan with creating partnerships with our unions to help people as they leave prison have skills so they can get jobs. Again, it's the best way to make sure that people don't recidivate. Give them opportunity, give them jobs so that when they are leaving prison, they are going into the community with hope. And so we're really excited about those apprenticeship opportunities. And then a goal that is really just a a goal that is a moral choice. We talk about, and we know that far too often in our state, people with behavioral health issues are being incarcerated instead of getting treatment. We really need to have a strategy. Again, this isn't just a state issue though, because decisions about how law enforcement is handled are obviously made on many times on the local level, but we want to partner with communities to help them come up with strategies to really divert people with behavioral health needs away from the justice system. Next slide, please. For health, safety, and housing, again, these are just a couple examples. As it stands now, the way it stands now, child support, if you are a non-custodial parent and you're paying child support to your child and your child is getting assistance, cash assistance from the state, any money that you give to that child or a percentage of that money goes first to reimburse the state for the cash assistance, and it doesn't necessarily get to your child. We're saying that if you are a responsible parent who's trying to live up to your duty to pay child support to your child, those dollars should go to the child. They should not go to reimburse the state. And again, Michigan is an outlier with this. This is something that we think should be addressed. And expanding addiction treatment. We know particularly at times like this when we know that there are a number of mental health issues that people are grappling with, particularly with the pandemic and other situations. But even before the pandemic, addiction has been a major problem statewide. It's not a problem that's just an urban problem. It's not a problem that's just a rural problem. It's all over the state. And so when we talk about safety, we want to ensure that people who want to get help for their addiction are able to get help. Next slide, please. The governor is really very concerned about ensuring that families have access to affordable, high quality childcare. We think it's really important. We have a number of very exciting programs that we'll be announcing, but the governor has talked about this repeatedly. One of the things that I do is work with the Michigan Women's Commission. They have studied return to work patterns and are finding that more women are not returning to work even when their industry has reopened in the pandemic because they don't feel comfortable sending their child to childcare. We want to make sure that more people have access and are eligible to have assistance for childcare. It's a high priority for us, and we're trying to be very innovative about how we expand that access. In addition to that, we want to expand school breakfast programs. We know many people believe that breakfast is the most important meal of the day. We want to make sure that any school that has more than 60% free and reduced lunch eligibility, that everyone will have access to breakfast. And it's something that we think is a real way to help with food security. And even in the pandemic, we have found ways to give students who are eligible access to access to food so that their families will have food security. But when schools go back, we want to make sure that those school breakfast programs are in place. And then we want to actually move schools more to breakfast after the bell. We know that the barriers that prevent some parents who are low income from getting their kids to school, sometimes in a timely fashion. If you're low income, sometimes you're relying on public transportation. You may have a job that doesn't have flexible hours, and that could pose a challenge to you. If your child is not there before school, she or he is going to miss out on breakfast. We don't think that should happen. We think that schools should move towards having an after the bell program for breakfast. Next slide, please. We also recognize that there are a number of really good ideas that do have significant budget implications. And so we are still pushing for them and still think that they are important, but we do have to recognize that they're going to be difficult. I actually think that one of these actually shouldn't be on this slide because it's expanding the Great Start Readiness Program, which is something the governor is proposing in her budget. She doesn't have in her budget money to expand this Great Start Readiness Program so that we have more families who have kids who are able to get high quality preschool education. We know that how you start your education. That pre-K experience can be so beneficial to young people. We want to make sure that everyone is starting out on equal footing. Increasing access to Michigan's earned income tax credit is something we really think we should have a conversation about. We know it's not going to happen in 2021. The governor has tried to expand it in the past, increase access in the past, and so far has not been successful. But there's a national conversation about things like children's tax credits. We think that we need to have a conversation about expanding the earned income tax credit. We know that in the past there has been bipartisan support for it. We want to continue to push for that. And then home visiting programs. We know that unfortunately we have some communities that are really struggling with maternal health, with the health for infants. Infant deaths are higher than in some cases in the kind of typical first world communities. We don't want to not address that. We think it's really important, and we know that home visiting programs have had a great deal of success. We know that we can expand some of those programs to ensure that we are accomplishing those goals. We also know that it's expensive. It might not be something we can do in 2021, but it's something that we want to keep on the agenda because we think it's very important. Next slide, please. We have had some accomplishments, though. We're really proud of some of the things that the governor has been able to do with the help, in some cases, the help of the legislature. One thing that we're very proud of is Michigan Reconnect, which is a program that we just launched this month. We already have, I think I don't know the exact number, I think 40,000 was the last number I heard of people who have signed up for Michigan Reconnect, which is a program to allow Michigan adults who want to get that post-secondary training, access to it, tuition support, last dollar tuition support. We've had tremendous success with that. Also with our Futures for Frontliners program, it's kind of like the GI Bill for those brave men and women who worked tirelessly at the beginning of that first quarter of the pandemic. When many of us were able to work from home, they still had to go to the grocery store to work or to the hospital to work. These are people who do not have a bachelor's degree, but do want to get either a associate's degree or other kinds of training for kind of 21st century work. We want to help them, and that program has been extremely successful in attracting people. But one thing I want to mention is that in our work with the Poverty Task Force, we are very cognizant of the fact that you can't just give people tuition and hope that they're going to be successful. I used to be a university board member. I would never be impressed when we heard about enrollment numbers, because enrollment is nice. What's more important is graduation. And so we think it's really important to give those wraparound services to the people who are going to be joining Futures for Frontliners and Michigan Reconnect, particularly single parents who have challenges. If you're a clerk at a store and you desperately want to upskill, you want to get better training so that you can get that next level of job, but you have a child, who's going to help you with childcare? Who's going to help you with transportation? Those are the problems that we want to try to solve. And we do have money. The governor has put money in the budget, or has asked for money in the budget to help with those wraparound services. And actually, we already have some money for that purpose, and we want to expand that money in the next budget. Expansion of unemployment benefits. It's another example of how COVID really laid bare for us how inadequate our safety net was. We had to expand our unemployment benefits because we did not have enough. People were not getting enough money. The governor lifted the amount that you could have as assets in order to get benefits. Things like food security, your housing, medical services. We want to do that. And so we're running short of time. So I think that we've been joined by Mike Larson. Mike, are you here? Are you on?
Yes, I am.
Okay, I just want to introduce Mike. Quickly, we do have the Tri-Share program. I'm just going to briefly tell you that will allow, it's just a new pilot that we have that will be a partnership between the state, employers, and employees. They would each share a third of the cost of childcare to ensure that people are able to afford childcare. So that's something we're really excited about, a new pilot that we're launching. Mike, can you just tell us a little bit about, I mentioned before that we're using the ALICE numbers as our platform. We really believe that 43% of Michiganders struggling is a number that is unacceptable. We thank you for all the work that you've done to create ALICE. And can you just tell us a little bit about your partnership with us to ensure that we're addressing the needs of low-income Michiganders?
Okay, thank you, Kim. I first wanted to say a special thank you to the governor and the Michigan Poverty Task Force for their leadership in this work, this so important work. The Michigan Association of United Ways and the United Ways across the state of Michigan have been focused on ALICE in our state for the past 6 years. For those that don't know, the ALICE report stands, the acronym is Assets Limited, Income Constrained, Employed. And the report is really about just real data at a local community level that helps us understand what those individuals who are working hard each and every day but struggle to make ends meet. And it's based off of just a basic bare minimum budget. And what, as Kim had mentioned, 43% of our households in Michigan struggle to make ends meet each and every day. We're talking about individuals, somebody single would need to make $21,000, a little over $21,000 or more to be able to just make that budget. A family of 4 would need $61,000. So there's no savings built into this. This is just real basic budgets that people are struggling each and every day. So we're really excited with the focus in this report. Our United Ways across the state of Michigan, there are many things that are so aligned in this report. So when we think about addressing the benefits cliff for ALICE, income eligibility for child care services, increase access to Michigan EITC, and the list goes on. These are core to moving people out of the ALICE population. And we're really excited to partner with the Michigan Task Force as they start this great work.
Thank you so much, Mike. We are really excited about working with you. We know that you'll be introducing a new ALICE number this year, and we're really hoping that we can continue to work to drive down that number so that we have fewer struggling Michiganders. I know that we were scheduled to end at 2:30, but we're really anxious to be able to answer a few questions that you guys have. Is there someone who can tell us about some of the questions that are in the chat, or are there questions that we want to answer right now? Let's see.
Yes, Kim, I'm going to go ahead and jump in. This is Erica with the labor team, and I'll read off the questions that have come in so far. So,
thank you,
first question we got was, what can we do to help promote the agenda, and what type of outreach can be done?
Thank you for that question. If you can, I'm going to put my email address in the chat. I hope that everyone who's on here, I think everyone who's on here is already on our mailing list. But I'm going to put my personal email address in the chat because we would love to work with you to build events. We're going to be doing presentations like this. I've already done 2 or 3 just since we announced the agenda last Wednesday. I want to fill my calendar up with opportunities to get the word out, but we also want to be really strategic for in the early days. I think that there's a lot of consensus, for example, on addressing benefits cliffs. So we want to work on both sides of the aisle to get that done. To the extent you have relationships in the legislature, if you have relationships with us, we would love to get the word out about trying to move that ball forward. We're really excited because we're hearing a lot of enthusiasm on both sides of the aisle for that. But yeah, I put my email address in the chat. I would love to hear from you to try to come out and come out to the extent that we can come out these days. I will be talking to you right from my living room like I am today, but I would very much like to meet with people who you think would be interested in this work so that we can build support for it. There's a lot in this report, 35 recommendations. Some of these things will require legislative support, so we just want to make sure that everybody is aware of what we're asking for, particularly those who have seen how inadequate our current safety net is.
Perfect. And this next question is from Mark Sanford Pelcher. And Mark is asking, can anything be done to address the misperceptions of some Michiganders as it relates to poverty and efforts to address poverty? Basically, helping address through public service announcements or other means the idea that Alice people are looking for a handout or draining rich people's tax dollars and other silly ideas like that.
Thank you. That's an excellent question. You know, sadly, I think that COVID has really helped us shine a light on the fact that for many, many years, for far too long, I think people who live in poverty have been vilified in popular culture, in politics, but particularly over the last year, people have seen their neighbors standing in line at food banks, their neighbors, having housing insecurity. It is not something, but actually some of them probably were suffering before COVID. And I think this is laid it bare for people who maybe have never even thought about people who live in poverty before. So I hope that there will be bravery among those who are struggling to join us to talk about the face of poverty. The face of poverty is not just what you see in Detroit or Flint or Pontiac. It is, in fact, the poorest counties in our state tend to be rural counties. And the poverty in rural communities can be devastating. So I think that a lot of it is just having frank conversations about how people are living, the fact that people who work every day are struggling. A lot of the tropes that kind of emerged out of this push for welfare reform need to be challenged. People need to understand these a lot of times the welfare that people were able to vilify in the 90s does not exist anymore. It just doesn't. We do not have that level. People aren't living on money that they get from the state. They're just not. It's not enough money for you to be able to pay your, comfortably pay bills without, having other sources of income. So this idea that people are just lying around, not doing anything and getting funding, it's just as you said, it's misinformation, and we have to be really strategic about talking to people about the reality of how people are living in poverty today.
All right, thanks, Kim. Our next question asks, what are some of the low-hanging fruit? What can be done the quickest within the next 6 months or so to assist this population?
Again, I'm very optimistic about benefit cliffs. And for those who don't know what that is, if you are receiving benefits from the state, from the federal government, I should say, if you're receiving benefits and you get a promotion at work, for example, there are people who actually will turn down their promotion because if they make more income, they're not going to be eligible for, say, their food assistance, or they won't be able to get a housing voucher. So people are making decisions every day to not have economic mobility because of the way our benefit system is set up. And I am really happy to say that people on both sides of the aisle seem to be ready to address that because it disincentivizes work, and people want people to be able to work and to provide for their families. So I am optimistic that that's something that we can do relatively quickly. I really think that that's going to be kind of our first thing out of the gate. There are some administrative changes. A lot of what we're talking about doing are administrative things that we can do to leverage technology, to leverage, kind of this cross-departmental cooperation that we have, so that the way we deliver services are, more efficient, that we're able to get more dollars to people who are in need. So those are the kind of things that we don't necessarily need legislative support for, but those are the things that I think just straight right out of the gate that we can get done right away.
All right. What opportunities are there for regional organizations to partner and support these efforts?
I thank you so much for that question. Again, if you can, actually, I'm seeing that my assistant Amaya Darkey has put in the chat that you should be sending your speaking engagement request to me. I would love to sit down. If you have a regional organization, I would love to sit down and talk to you about how you think you can best fit in. I mean, I think that there are a lot, when we talk about how poverty is lived by people, there's a different lived experience for a person who's living in poverty in an urban setting, or someone in a suburban setting, or someone in a strictly rural setting. And those regional organizations, I think, are really going to be critical to help us move the needle. So I very much would like to sit down with you, strategize about how you think we can best use your talents and your connections and your lived experiences to help us move this agenda. So I'm going to put Amaya's email address in the chat. I put mine in, but she kind of slapped my hand there. So I'm going to put hers in instead. But you're welcome to call me as well. Or email me as well, I should say.
What are the most actionable items?
The most actionable? Again, I think, I talked about benefits cliffs. Obviously, that's the thing that I think legislatively is most actionable. Some of the changes that we're looking to make that we can do administratively, the governor has already signed on to. We've already, as I mentioned, some of the accomplishments we've had, we've already moved in the right direction. For example, the governor, like one of the proposals we have, just for example, is to remove asset tests altogether for food benefits. The governor changed the rules to increase the asset test to $15,000. We don't think there should be an asset test at all for food benefits. Michigan is actually kind of unique, not unique, but there are very few states that actually have an asset test. I think there are only 16 of them. Michigan is one of 16. That's something that we think we can do relatively easily. We hope so. So those are the kind of things that we're looking at and hoping that we can do fairly soon.
All right, and this question comes from the, President Buffington of AFS-CME Local 1659, asking, what is the makeup of the task force? Where is it through? How is data collected and from whom?
Okay. So the task force, by the executive order that the governor introduced to set up the task force, is made up only of state employees. We have 14 state departments that are at the table. The directors of the department, she wanted to have high level engagement. As I mentioned, we met with them early in 2020, and then from there they appointed representatives to meet with us in our work group. So the task force is made up of state employees. However, we do have an advisory council that is made up of 3 legislators. We have 2 members of the Michigan House of Representatives and 1 state senator. And then we have 3 practitioners who are working with people who are living in poverty, who work with community development organizations and other organizations like that. What we're doing, we spent the first year, again, kind of examining what kind of barriers existed in state government and how we can better leverage state government to serve the population. And that's what a lot of our research was on in the first year. And that's how we came up with these 35 recommendations. We'll be doing deeper dives in our second year of operation. One of the things that we're hoping to do is to really look at some of these levers that we've introduced as recommendations and how, what the practical impact they will have on moving more people off of poverty. So we're working closely with organizations like the University of Michigan's Poverty Center. We're working with other organizations to, and we're going to be working with a number of other academic organizations so that we can get really strong research-based, evidence-based research that will help us. For one thing I want to mention that we did have in the recommendations, I think that a lot of people make the assumption because we have fewer people who are eligible for benefits or who are on benefits, that means that welfare reform has been a success because that's their metric of success. No, I don't know how many people have really taken the time to go back and look at people who used to receive benefits to see what the outcomes have been. I think there's been this assumption that people, they're no longer eligible for state benefits, so they get a job and live happily ever after. But those of us who are working in the field know that that's not necessarily the truth. So we actually are commissioning a report to really study what has happened to Michiganders who were once able to be eligible for support who aren't getting it. What has been their lived experiences. So that's one element of it. So when you ask about research and how we're gathering it, I think the next phase of it will be a lot more focused on kind of evidence-based research. The first year was just an evaluation of what we had in place and what we think would work to better serve Michiganders.
All right, Kim. Well, we've gone over time, but if you can just kind of close out by sharing with us, one of the accomplishments out of the Poverty Task Force that maybe you're most proud of and why.
Well, I think that, again, even before, I wish I could take credit for a lot of this stuff, but I think that one of the things I'm very proud of is that we really approach this work with an equity lens. And so when we saw policies that were in a, although I think most people, or a lot of people, think that people of color are the face of poverty, which is not true, because poverty is in every it's in every community, just about every community, every race. And so I think that the fact, but there are conditions that have been in place that have made it more intense for brown and Black people. And so I think the fact that we started our work with that lens is something I'm very proud of, because we're trying to follow that through. And then we're also proud of the fact that, with some of the things that were done early on, like, unfortunately, because of COVID, our DHHS department, for example, has had to be incredibly innovative to kind of go back and retrofit a lot of our rules that really were designed to keep Black people out of support and help. And I just think that we need to use that as a platform. We saw that what we had was inadequate. We need to fix that and make it permanent. And that's kind of the message. If there were essential message of our report, I think that's what it would be. That what we're doing now is not working. It's not enough. And we need to go back in and rethink it. And I think that this is a really positive first step toward having that discussion.
All right, that's all we had for today. Thank you so much.
Thank you.